start, I would like to request Naganandini Madam to come forward and give a bouquet to our today's speaker, Dr. Navrange sir. Sir, please. Thank you very much, ma'am. इथे साईडला ठेवलं तरी चालेल मला त्यांना. I request Rajeshri Devkar Madam, Sales and Senior Executive at BSSK, to give an introduction about Dr. Navrange sir.
Good morning, everyone. We are very happy to introduce Dr. Jayant Navrange, a highly respected pediatrician who works with many well-known hospitals such as Sassoon Hospital, Dinanath, Sahyadri Hospital. Along with this, he is associated more than 44 years with Srivatsa and Bharatiya Samaj Seva Kendra. He has an excellent academic record, winning gold medals in MBBS, DCH, and MD, and also completing LLB. Dr. Navrange has held important positions like President of IMA, Pune, IAP Pune, and IAP Maharashtra. He also serves as a Vice Chairman of Medico-Legal Cell at IMA headquarters, where he has guided more than 2,000 doctors and designated the first medico-legal course for IMA. He teaches as a visiting faculty at ILS Law College, Pune. Along with his medical work, Dr. Navrange is also a sport enthusiast. He has completed 26 half marathons, full 4 marathon, and is a champion in cycling and spinning. He has donated blood 65 times, showing his commitment to helping others. He has also received the Bertha Holt International Award for supporting the rehabilitating more than 1,000 children over the last 44 years. He also served as a chairman of IMA-MS from 2018 to 2023. We are honored to have with us today a multi-talented and all-rounder personality, Dr. Jayant Navrange, as our estimated resource person. Now I invite Dr. Jayant Navrange to take over the session. Ladies and gentlemen, please give a big round of applause as we welcome Dr. Jayant Navrange to the stage. Doctor, the stage is yours now. Thank you.
Thank you, Dr. Rajashri. And this is a very nice occasion. Nice occasion of our National Adoption Week, National Adoption Month celebration program, which is associated with first Prime Minister of India, Jawaharlal Nehru, on 14th of November. And I must acknowledge the presence of very important and very great dignitaries on the dais, of the dais, particularly all my colleagues, senior and junior colleagues also. Dr. Geetanjali is here. She is an ophthalmologist. Dr. Barasaheb Deshmukh is there. Madam is already there. And Dr. Halbe, who is an anesthetist. And also our director, all the staff of BSSK, all of you prospective parents and various organizations, I welcome you to this hall, which luckily I have been instrumental in building this total building. So right from the inception, each brick I know very well, and I can recognize that after the installation of this new speaker, first time I'm speaking from the microphone. So I'm the user of this new microphone, first time. It has been installed about 2 months back, but this is a new one. So anyway, let's go with the topic of how we assess the medical condition of the prospective adoptive child. So the basic question about anybody who is going to adopt a baby, they have already suffered the problem of infertility, or they might have been waiting for such a long time. So it should not so happen that we are selecting a wrong child. I mean, not wrong child in the sense that age-wise, sex-wise, etc., but what is the condition of this child health-wise? And what is the prospectus of this child in the future? He should become a normal citizen. That is the basic aim of today's talk, whatever we will be covering in the next 1 hour. So is my baby physically sound and mentally competent? I'm not saying super intelligent. I want to see that it is mentally competent to become a normal citizen of this country. And whether he will be alert, what is his or her potential to grow? Today the baby may be looking small. It may be, I think I missed my colleague Dr. Anjali Sabane over here, that she was Assistant Chief of Municipal Corporation Health Department. So, and Ranjit is already there. So I'm sorry for that. So coming back to the point that today the baby may be looking small, but small is not bad. This is the time of miniaturization. So you have come from big computer to the laptop to the mobile, which is acting as a computer. So what I'm aiming at, that a baby who is 1,000 grams today, are you going to say no just because it was 1,000 grams? So from that point of view, I mean, all of us know the lessons in physics, that if I'm holding this piece over here, some meters away from the ground, it has the potential energy. You don't know what is going to happen. But if I drop it, it's going to go with the energy of gravity, and that is the kinetic energy. Movement is kinetic energy. So that way, from this point of view, the first inaugural statement I'm making, look at the potential of the child. And that potential needs to be seen from the angle of an expert. So this is very important. No doctor is allowed to give any warranty. No warranties, no guarantees. And those who give the guarantees and warranties, how they behave, you know very well when the question comes. So we are saying we are not going to give guarantee and warranty. But this is a logical conclusion. How far accurate we are, that will come to that. So how far the predictions are likely to be correct, accurate with the background that which may not be 100% available to us. But at the same time, this is the thing which I added today, that you assure your health as parents. Because see, this whole act, I think government officials are there to take care of this angle, that if a baby is being placed in the hands of parents, what is their health condition at the end of 25 years? So any baby who is 1 year, 2 years today is bound to take 25 years. They require the parental help. And we are finding a very negative picture over here. Most of the parents coming to us are beyond the age of 35, and many of the times they are above the age of 40. And they are 50% of the time suffering from blood pressure or diabetes. They are two very important diseases which are silent killers. And after we started doing this, this is not a CARA requirement, but we are insisting in all the institutes where we are going, that please get your hemoglobin done, basic testing done, blood pressure done, and also the sugar level, and not sugar level HbA1c. And these parents are grateful to us, saying that luckily because of your insistence we have got the things done and our disease has been diagnosed in time and we can take the timely treatment. These are good diseases if you take treatment. So it is not that we are going to say no, but get yourself checked up properly. So we would like to have the proper assurance from you that you are taking care of your health. Because we please understand the central theme of the Juvenile Justice Act, which deals with adoptions, is the child welfare. It is not just meant to give you enough satisfaction that we have got a child. The main theme of this act is child welfare. So we have to take the sort of an assurance from you that you will be taking care of your health. So first and foremost, those prospective parents who are available over here or who are watching this particular YouTube presentation, relax. Most of the times, 99.9%, we are going to give you a very healthy and normal child. So let's see how the children come to the institutes when we are talking about the children who are available for adoption. This is only from medical point of view. It's a separate topic that how the children come to the institutional care. What I'm going to say that from the prospective adoption point of view and health wise, how I look at it, and that is number one, children found by the police. So child or a baby may be discarded anywhere, may be thrown off in the thorns, in the jungles, it can be on the platform or it can be on the shore of a seashore or a river shore also. Number two, so here, what is the percentage? Approximately 25%. So 100 children coming to the institute, 25% of them are brought by the police where we don't know anything about the parentage. So this is one small group out of 100%, that 1/4 of the parentage we don't know anything about it. But remaining all these, we know at least one side who is the parent. So relinquished child, and that's much more common in this country, that usually the unwed mother gives up the baby after birth, and at least 50% of the parentage is known to us because the mother is coming to us or the relatives are coming to us, and she may have delivered after coming under our care. So if the lady has come to us before delivery, we have all the information, whatever the circumstances surrounding the birth. So a lot of history as far as the baby, medical history as far as the baby is concerned is available. But it's in about 67%. So 25% found by the police where no parentage and we don't know any details of the parents, and forget about the genetic background. 67% we know who is the mother and surrounding story about the birth. Both parents coming together and giving up the child, about less than 3%, 4%. Sometimes the natural calamities like earthquakes, you know the Bhuj earthquake, you know the Khilari earthquake which happened about 30 years back, then the flash floods or tsunami, you remember all these things, where the parents might have died, but the baby survives. And in this situation, the parents' friends, family friends, or the relatives might look after the baby's welfare. They would like to bring up the child, but after a few months they realize that it is beyond their capacity. They are incompetent. In that situation, you know the background, who was the father, who was the mother, what was their genetic pedigree, and you know the background of the child. So it's only in those 25% we don't know about the birth history, we don't know about the pre-birth history, that is called as antenatal care, and we don't know who were the parents. And the last one is a good situation where when parents come to know of some major disease in the baby, now major is their parents' apprehension. That is because most of the hospitals and maternity homes where the delivery has occurred are now visited by the pediatricians, and they would find out that this child has got this anomaly, this heart problem, or 6 fingers are there, minor to major. Major is labeled by the parents, and they feel that they are incompetent to look after the baby, and therefore they give up the child. So, but these are comparatively rare. First two are very common, found by the police, 67% relinquished by the mother. So the beginning of these babies is like the Twin Tower disaster. I think in the year, that's ill-famously known as 9/11, where the Twin Towers were attacked. So beginning of the life of these children is like this. It's negative. So, see, this is CNN breaking news at that time. but at least over there, they know the date of birth and they know the time of exact birth. Here in these cases, we may not be knowing about 25% of the cases. So coming to the basic point again is how to arrive at an accurate diagnosis when the background of the child may not be known health-wise. So whenever we talk of diagnosis in medicine, it's based on three legs. One is the medical history. Second is the clinical examination. And third is the appropriate investigations. I think all my doctor colleagues will agree that any time coming to a diagnosis of any disease is based on these three things: clinical history, clinical findings, and third thing is investigations. It is easier to understand that remaining two legs are absolutely intact. Examination of the child, right from top to bottom. Our commissioner sir has come. Welcome, sir. Sorry, we had to start and it's getting transmitted all across. So welcome, sir. So any diagnosis of a disease is dependent on these three legs, and that's why I'm calling it as a stable stool tripod, three legs. Clinical examination, medical history, clinical examination, and third thing is appropriate investigations, out of which two are intact. So what about the one thing which is medical history? As you would realize, in 75% cases, see, apart from those 25% coming from police, we have that history available. 67% because the ladies are coming and giving up the child. Remaining all these calamities, natural calamities, man-made calamities, you know some history at least. And when the both parents are coming, no issues whatsoever. So we will concentrate on those 25%, that missing part of the history. Okay. So medical history, from a child's point of view, important things are birth history, whether it was a normal delivery, whether it was a full-term delivery. So normal human pregnancy is 40 weeks. Whether the baby is delivered before 37 weeks, it's called premature. Less than 2.5 kilograms is called as low birth weight babies. So these things are medically important. However, please remember that just because the baby is of less weight, once again I'm saying miniaturization is not to be taken as a very negative point. The main thing which I would attract your attention to, in these smaller babies, as a doctor, I would take more time to say this is a normal child before I can allow it to go for adoption. But this may not be followed by all, not all across the country. We are talking all across the country. And therefore, what we will say that there are certain parameters to be checked, and that I will come to one by one. So all these appropriate tools are laboratory investigations, radiology, USG, sonography, X-ray, CT scan, PET scan. I would get breathless if I go on telling all the tests, and that's not the purpose of today's talk. So out of these three legs, now I'm coming to another point. See, I'm not saying out of three legs, two are intact. I'm saying 2.5 are intact. Why? So we'll come to that one by one. Any child who comes to the institutional care, before it is sent for adoption, available for adoption, it takes about 2 months. And that 2 months period is good enough to get us adequate history from the point of view of what's child's future, how the baby has behaved health-wise in the 2 months period. So that is why we have labeled it as 2.5 legs. Following these things, why I am saying that confidently? It is based on more than 45 years of experience and more than 12,100 babies who are family deprived, and more than 75% of them are less than 1 month of age. That 1 year is there, but most of them came to us at the time of less than 1 month. Why I am insisting on 1 month? It is that newborn period. Technically speaking, newborn is not just something born today. Newborn is from birth to 1 month, birth to 28 days. And that is why I'm saying less than 1 year. Most of them are less than 1 month. Now, let's see the negative points first, and then we'll see how we overcome those points. Number one, negative point is antenatal care. This is an unwanted pregnancy. See, there is a basic difference between a child being born because it is wanted and a child being born because it could not be prevented. So there is a basic difference between the two. This was a beautiful sentence from Shaw's textbook of gynecology, which says that a child should be born because it is wanted and not because it could not be avoided. Here the situation is exactly opposite. This child is born just because it was not wanted, and the period of termination of pregnancy was over. So period of pregnancy of more than 4 months was over. Number two, and that's why it's a neglected pregnancy. The mother would not get any medical care, or nutritionally she might have suffered, and she is passing through a very stormy psychological period, physically, psychologically, nutritionally, pharmacologically, because she might have attempted to take some medicines also. So whether there is a side effect of that, result of all this basically is a low birth weight baby. Technically, less than 2.5 kilograms is a standard definition world across. In India, we say 2.2 kilograms. Less than 2.2 kilograms is a low birth weight baby. But we are happy today that any child more than 1200 grams, I can assure you, no warranties, no guarantees, but assure you that it will be a normal child. So 1200, that medical care has advanced now. So more than 1200 grams, you should be happy. So low birth weight baby is one of the resultant factors of these negative factors. And secondly, it could be a premature one. Premature means by definition, less than 37 weeks of pregnancy. So what is the negative factor in this? These children are born miniature, smaller. They are normal children in majority of the cases, but they are endowed with less bank balance of their nutrients. Now please understand this very well, that if a baby is born today at a weight of 1000 grams, 1 kilogram, the child's hemoglobin will be 20 to 21. Today, our hemoglobin would be 12 to 14 grams. A normal 40 weeks pregnancy child will have 17 grams, 16 grams. Now, why this difference? Smaller the baby, higher the hemoglobin. But then, whatever is required to replenish that hemoglobin, it requires more iron store in the liver. And that storage of nutrients in these babies is less, because most of the nutritional storage occurs in the last 3 months of pregnancy, or when the weight gain is okay. So they are endowed with 3 important nutrients less than average. Say, poor parents transmit less, their children will inherit less amount of property. Same way. So what are they inheriting less? Less protein, less iron, less calcium. These 3 will be less, and they reflect in rapid drop of that hemoglobin from 20 to 8, 20 to 9. Now why that hemoglobin is important? Hemoglobin is directly linked to IQ. This is a growing animal, growing creature, and where it's not just growth, it is growth and development. So endowed with less nutritional stores of iron, calcium, proteins in the liver, bone marrow, lack of reliable history, even institutional history where the lady delivered may be lacking medically. And the mothers are universally, I am using the word carefully, universally anemic, infected and stressed. However, nature is great. You may call it nature, you may call it God. The basic principle in nature is that next generation must survive. And therefore we have seen, I think one picture will be there, where the hemoglobin of the mother was 2 grams, but hemoglobin of the baby was 20 grams. So that is a perfect parasite. In nature, the next generation must survive. In real life, save the source, save the mother. Another negative point is lack of breastfeeding. Breastfeeding is like golden standard nutrition for babies. Whatever costliest of the milk you give, some tins are there which are, I think, 3,000 rupees per tin, which is finished in 4 days. They do not match with the breast milk. And the government rule is, and rightly so, the moment mother wants to give up the child, has to be separated from the mother. So breast milk is out of question. So can you keep the baby hungry all the time? Not possible. We have to give substitute milk. And that substitute milk Either it is cow's milk, buffalo milk, fresh milk, goat milk, or it's in these days they are powder milks. But remember, they do not match that gold. These are nothing more than tins. So there is a big difference between the two, but you can't keep the baby hungry, and not that everything is lost. But the more important thing is what you give, which milk you give, more importantly, how you give it. And that's where is the very important point that, please mark my words, all bottles are bad. That means bottle of alcohol, bottle of medicine, and bottle of milk are equally bad. Why? Because they have the inherent risk of getting into gastroenteritis, vomiting, diarrhea. This in turn leads to nutritional deficiencies and therefore less resistance to other diseases. What happened in what happened in HIV? In HIV, people don't die of HIV disease. Because HIV paralyzes the immunity of that person, they die of simple influenza. They die of simple diarrhea. They die of simple tuberculosis, which are otherwise curable. So same thing happens in nutritional deficiencies caused by vomiting, diarrhea. Also the thrush, so many things are there with the bottle feeding. I hate bottle feeding, but we are helpless that when one adult is looking after 4 children, and you require to give satisfaction to the baby, of satisfaction of sucking, bottle feeding, there is no other alternative. But then I'm very proud to say that last 18 years now, we did not have a single death caused by bottle feeding leading to diarrhea. So that much training is required of the people who are looking after these babies. So last 18 years, though one cause of death in children today world over is pneumonia, second cause is gastroenteritis. In our institutes, there is not a single death caused by vomiting, diarrhea. There is gastroenteritis. And recurrent chronic vomiting and diarrhea, these are the effects of bottle feeding, undernutrition, protein in malnutrition, vitamins, anemia, diaper rashes, etc. And remaining these diseases as what we see in our private practice are the same. So these are some added diseases compared to what we see in our pediatric practice. Tuberculosis is extremely rare. So root out that idea that these children may be having tuberculosis, because tuberculosis in children come from adults who are attending on the children. And these adults are looked after, they're screened every 2 years. Number 2, syphilis is almost non-existent now. Once in a while we are getting a case. Otherwise they are all, and that's very treatable also. Seizure disorders, that's convulsions, is also luckily less for us. So the baby has come to the doorsteps of the institute. In any condition, maybe 500 grams, 600 grams, 700 grams, cold, maybe very hungry, crying. So what we do assessment in the initial stage, the moment the child comes to us, Dr. Navranga is not going to be present every time. He will be visiting once a week or twice a week at the most. It's the staff which are our cornerstones, and they have been well trained. All across we will show these signs. What are the signs of dangerous diseases at that stage? That first and foremost thing is save the life. Number 1, whether this child who is brought to us is critically sick. And that is seen first. If the child is sick, no history is taken. Child is rushed to the hospital. That's number 1. So save the life at any cost, that's number 1. If the child is not critically ill, usually by the time they arrive to us, come to us, they are hungry. If the police have brought it, it would be 2 hours, 3 hours. So child is given the feeding first, then checking the papers, then cleaning the child, then giving a bath, putting on our clothes, and then take the important measurements. And this is the most important underlying physical parameters in the absence of history is the weight of the child. Weight of the child. That's in grams, not in just kilograms. Number 2, so it has to be an electronic scale. Number 2 is the length. We don't have height of the child, so the child cannot stand. So we take the length of the child. But very important is head size. Now how important is this head size? I can just remember one editorial comment of the Yearbook of Pediatrics way back in 1998, which says that this measurement is always forgotten because it is free. You require just a tailor's tape to take the measurement of the head size, and that gives you adequate information about the brain condition. And this is the basic level, what we call as fundamentals about monitoring the child's growth and development, is the weight of the child, length of the child, and head circumference. So what does it head circumference indicate? Size of the brain. Whether the brain is growing, and whether the growth is within limits, or it's exceeding the limits, or it's getting less. All these are very important, which no CT scan and no MRI is going to give that information. You require the head size measurement. Detailed, regular, serial record keeping by the experts is required, and that will overtake that missing half leg. What's that? See, each word and each adjective is important. Detailed, very regular basis. Serial, it's not one-time examination. It's a serial examination every day, every week, every month, till the child is in the institute. Record keeping, because here the changing hands are there. What happens in a family? 4 adults are, that is parents, and parents, either side's parents. And if they are not there, some hired help. So 4 adults are concentrating on one baby. And what happens in an institute, best of the institutes, is going to be 1 adult worker keeping a watch on 4 children. So there is a 16-fold difference in the individual attention to the child. Please remember this. It's a 16-fold difference to begin with. And then there is an 8-hourly duty, 16 into 3, 48 times less individual attention. And then there is a weekly off. I think you are with me. So 60 times less individual attention per child as compared to the family. And in spite of that, let's see what happens. So for my children, I have not kept these records. I have not done this way, because we are constantly watching, without saying, 24/7, years together. We are concentrating and focusing on our children's growth and development. What is happening here? Changing hands, and the next person has to get the information. So regular daily weight up to first 6 months, daily weight. And daily weight has to be the gain. This I always crack a little joke over here, that children have to gain weight every day and adults have to lose weight every day. So detailed, regular, serial record. Then we take the head measurement every month, because it doesn't grow every day. It's impossible to measure that. And length of the child every month. So these 3 are important parameters as far as the growth factors are concerned. So right now I am concentrating on growth. The basic difference between pediatric medicine and adult medicine is growth and development. Up to 25 there will be growth. After 25 there should not be any growth. It should be a deceleration. So it's a natural phenomenon. So detailed, regular, serial record keeping, these words will come again and again. The last sentence of each slide is important. Serial monitoring is vitally important. Serial monitoring of all these is vitally important. I'll be a little faster now. And the third part is lab assessment. These are certain tests which we have formulated. Luckily, CARA has accepted them and has made compulsory for all the institutes in the country. And these are hemoglobin, WBC, peripheral smear, thyroid testing, because it is related. See, man survives by his intelligence. Man survives with his brain. Otherwise, there are many animals who are bigger than us. Elephants are there. Some are very furious, like lions and tigers. In the sea, there are sharks. We have overcome all them. We means humans have overcome all them. Why? He survives with his brain. And I am concerned that these babies should be surviving equally competently as normal children, getting all the facilities in their own families. So thyroid test, deficiency of hemoglobin, IQ will be adversely affected. Deficiency of thyroid hormone, adversely affected. It is mandatory that this test is to be seen. Many institutes are not doing. It's my humble request to parents who are sitting across the country that they should be checking whether thyroid test has been done. It is your right to get the report. So if the institute, particular institute has not done, please ask them in writing by sending an email to them that thyroid test is mandated by CARA, which I need to have the report before I say yes. Also write simultaneously to grievance cell of CARA. Then the blood group, not at all important. VDRL, that is for test for syphilis or sexually transmitted disease, HIV, hostile antigen, these are mandatory tests by CARA. CARA is the central agency. Urine stool, as and when required. Repeat the hemoglobin. This is my request, that repeat hemoglobin every 3 months, because every baby in the world, it's not India, every baby in the world has to go down in hemoglobin from 17 to 9 to 10 to 11. Every baby. So that will occur naturally. So 3 monthly hemoglobin is required, because it is again directly linked to IQ. It is directly linked to IQ. I'm giving maximum importance to IQ, not the size. And other tests as and when required, like ECG, EMG, USG, all are available as and when required. They should be used judiciously. Then these are exhaustive list. They are not mandated by CARA, and it's rightly not mandated by CARA. 2D echo, abdominal. We get requests, doctor sahab, all tests karke le lo. That is a nonsense. If I go for all the tests, there are 2.5 lakhs tests on the blood. Child will die of bleeding. He will lose all the blood. That is not at all. See the last sentence, use the laboratory, radiology, etc. judiciously, as and when really required. Certain tests are mandatory, others as and when appropriate. Then about HIV, you might be a little interested in this, that whether my baby has got HIV. 1% of the women attending the government medical facilities are HIV positive, and HIV can be transmitted to the baby. So how do we assure that this baby does not have HIV disease? That is important, and that is that government has launched this MCTC, Mother to Child Transmission Inhibition Program. So apart from that, we'll see about our babies first. The child has come to us, has stabilized, okay. Then we go for blood testing as per CARA guidelines. One of them is ELISA test. Those parents sitting in front of me right now here or listening to me, it is a mandatory test for the parents also. So you know what is about ELISA test. That test depends on a principle. I think after COVID, everybody has become very intelligent in antibody and antigen. So antibody test, it depends on antibody test. So antibody to the HIV germ, it's not germ. So ELISA test depends on an indirect principle that when there is smoke, there is fire. Or you're looking at the rear view finder mirror while you are driving. You know some car is coming from behind. But is it the real car in the mirror? No, it is an image. Same way, ELISA is an image, sort of an image tested by antibody to HIV presence. Now here is the difference. Adults having HIV, ELISA positive, there is antibody positive. 100% correct that the person is HIV positive. Germs are there. It's not at all true for babies at this age. Why? Again, the nature's phenomenon. Nature wants the next generation babies to survive. So what is it doing? See, it's a beautiful anatomy, beautiful structural arrangement of a sieve. In between the baby in the womb and the mother, there is a placenta, which is nothing else. I mean, it's a very active sieve. It allows the antibody to flow into, cross into the baby, but doesn't allow the virus to grow, virus to cross through that placenta. This statement is true to the extent of 95%. I'm coming to the remaining 5% also. So 95% of the times, antibody has to cross, will be crossing the placenta, going into the baby. And what test we are doing? We are doing the ELISA on the baby, which depends on antibody. And antibody will be there. If the mother has antibody, the baby will be having antibody. Mother is having antibody, ELISA positive, baby will have positive. If you get a report that mother is negative and baby is positive, something is wrong in the reporting. It is 100% couple. That mother is positive, baby has to be positive. If the baby is positive, mother has to be positive. If either of the discrepancy is there, something is wrong in reporting. But let's understand, laboratories are correct and baby's ELISA test is positive. Now ELISA test is positive. Now we have to find out whether the virus has crossed into the baby. I told you 95% of the times it will be kept back by the placental sieve. Then second transmission occurs at the time of delivery, and that is prevented. If the mother has come to us before delivery, it is prevented by cesarean section. You don't allow the two bloods to mix. And third way of transmission from mother to the baby is through breast milk. So if the mother has come to us even a few minutes before delivery, the test is done on the mother ELISA. If she is positive, immediately her cesarean is planned. Of course, you require a consent and all that. And she is given a drug called navirapine. That navirapine is effective to the tune of 99%. Even if a single dose is given 20 minutes before, that's lucky to us, lucky to mankind. So these are the ways of prevention from mother to the baby. But if the baby has come found and not before delivery to us, she has delivered on the streets and the child has come to us and HIV is positive, then the factor comes, how do we detect that whether she has got HIV disease or not? And this is the, welcome sir, he is Dr. Sanjay Patil, our executive trustee, and we missed you in the inaugural session. So that test is PCR DNA. Sir, puriya na. He is an ophthalmologist, a very enthusiastic executive trustee of this association. So virus can be detected. We had detected the antibody in the form of ELISA, but whether that particular person, child, is having the disease or not, this is the final test. PCR, DNA, if you want the full form, polymerase chain reaction of desoxyribonucleic acid of human immunodeficiency virus. And this test is most reliable at the end of 1 month of the life, not before that. So this test, if ELISA is positive, baby is retested with this test at the end of 1 month, not before that. And the second test is again done at between 4 to 6 months after arrival. If 2 tests are negative, child is declared as negative. Why I am saying that? Because you should not be losing a chance of a good baby just because ELISA is positive and the child is really HIV negative. This ELISA test will become negative. Majority of the cases less than 6 months, but sometimes it can go up to 18 months. Today the guidelines say, wrongly, I am specifically saying wrongly, that wait for 18 months. This is a big nonsense. 2 tests PCR done negative at 2 different laboratories. Preferably one of them should be a National Institute of Virology. If they have never gone wrong. So if they are negative, child is declared negative medically. I asked this question, why it is 18 months? It is only because of some stray remark by Supreme Court, who are non-medicos, and that has gone into the guidelines. So really speaking, 2 times test negative. I cleared this with Dr. Gangadkar, who had come to here on the same stage about a month back. So take the child if the PCR test is negative. So again, revising it, careful, detailed, experienced monitoring. Clinical assessment of development, now coming to the development. We've seen about growth. So whatever those 2 months are available from the time of, say, right now it might be 11:30 or 11:45. Today is 22nd of November, 11:45. 2 months more, 22nd of January 2026, 11:45. That amount of history is good enough to check all these things and how the child is growing. If the growth is as expected, and what is that growth, we'll come to that. If the growth of the baby who has come to us in the institutional care with all this outside milk is 500 grams per month, we are happy. 500 grams per month. For breastfed babies, we require 800 grams. That's the difference. So it's going to remain a little smaller. But don't worry. We have to see now, next stage is development of the child. At what age the child started focusing with the vision, with the eyes. What time you could listen to, I mean the ears are there, but whether they are listening. So all these things are available. And then we see, monitor the growth of the head, monitor the height growth and so on and so forth. Out of which height is mainly dependent on genetics and nutrition. So we can't do much about it. But rest of the things can be done easily. Again the same sentence. Monitor the hemoglobin every 3 months because it definitely gives idea about the future IQ. Now I will just show some of the pictures. See some of the abnormalities which look like something may be there. It's a red spot. It's called as port wine spot on the, anywhere it can be on the body. The common things, I mean commonly they are seen on the face and cheeks, and it can occur anywhere on the body. These are nothing else but capillary hemangioma. So this is capillary hemangioma. That means collection of minute blood vessels. They will grow with the baby, but again disappear completely by 2 months of age. In majority, they will disappear. And these are very treatable conditions. Extra finger, a cleft palate and lip, a posterior cleft lip, extra nipple. So it's called a supernumerary nipple. These are innocuous. Of course, I would just warn here, a word of caution. We see one abnormality, that child has to be screened for other abnormalities. But once they are not there, this is a free hand to go for a normal child and normal adoption. Supernumerary nipple. So many pictures, not uncommon. And this is how the baby comes, a child abuse case. Child is given all stimulation, physical stimulation. Sometimes they require nebulization. Don't worry about this. This is not asthma. These are temporary conditions. It's called as virus-related lower respiratory infection or wheezing. So don't worry about that. 40% of the children in Pune in this season, November and December, they suffer from this. I'm not saying orphanage. I'm talking about the general public also. 40% are requiring. So not a small amount. And then footprints are taken just for identification purpose because thumb prints are not developed at that age. This is a very rare case, a very grotesque case. This child had male genitalia which were chopped off at the age of 3 days, thrown out on the shores of Mula River at Paud. The child is surviving. So this is very rare, but the humans can go to any barbaric actions. So just to kill, instead of that, it would have been better to kill the child. But they have chopped off the male genitals. Terrible. A big white patch, I would rule out leprosy. It has been proved by biopsy, not there. A big black spot here, and that's the big eczema. Can you see a small hole here? You can see because the arrow is there. And that's a small pinhole-like arrow called as preauricular sinus. But it has a connection right from here, behind the ears, under the mandible, right up to the center of the neck. So these things, once a small pinhole is there, we would investigate this child totally with sonography, etc. Where there is a kidney anomaly, where there is a heart anomaly. So one, it's pointer, but majority of times it does not turn out to be like that. So this is how the baby comes to us. This is how it grows, and it walks out very healthy and happy. And this is a child, just I took a picture here in the inset, saying that a 4-year-old child weighing 6 kilograms, it was that malnourished. This is at Sophos. That malnourished. But then, just a good thing was, she was very hungry. She would finish up this bigger pack of Parle glucose at a time in 1 minute. So good hunger indicates good health. Not for you and me. So what is to be expected? Expect a delay of 2 months. Initial delay of 2 months in these babies. At the age of 1 year or so, 6 months onwards, up to 2 months everything is okay. Why? Because individual attention is less. In the best of the institutes, I told you the figures, it's 60 times less individual attention than compared to the family attention. And therefore, in a lifespan of 85, today if a child is born, we are expecting a lifespan of 85 years in India. So for 85 years, give a grace of 2 months. Just give the grace at the most. Most of them are at par, but they might be remaining behind a little. So just don't say no to these babies, because I am seeing off late, we are sending to develop, I'm not criticizing anyone, but then we are getting IQ, DQ done. It's a nonsense test. At 2 months, what IQ are you going to assess? But if wrongly it is sent, They will say 1 month behind, 2 months behind. Arey Baba, it is bound to be there. So don't do these tests. Actually, these tests are just rough guidelines. If done in the expert hands, at 3 consecutive times, at an interval of 1 month, they are having an accuracy of 50%. So there is no need to do these tests. So almost all the major milestones are likely to be delayed by 2 months. So give a grace period of 2 months. So what is our death rate? Children's infant death rate is taken, IMR, infant mortality rate, is out of 1,000 children born today, how many survive at the end of 1 month? At the end of 1 year. That figure in India has come down to 27. It used to be 173 deaths in 1975. So from 175 it has come down to 27. And today in Maharashtra it is less than 17. And in orphanages, at least where I am going, is less than 1%. The reason is the staff. Is the staff training, continuous monitoring, expert eyes, all the advancement in the medicine, and all these small babies are surviving intact. So survival is assured. You agree with me? Less than 1%. It is matching with Sweden. Sweden has the least infant mortality rate. Better than USA. But here statistics show that it is better than that also. Why? It's not because we are great. It's because of careful monitoring. Number 2, it's the same doctor. Number 3, what happens in private? If you don't feel better, the patient will change the doctor. Here it is the same doctor. If he is keeping the eyes open and is mindful, he will go to the root cause of it, why this child is suffering. And therefore, the mortality has really come down. So now that life is assured, we are to take care of the special senses. And that is hearing. Hearing is now made compulsory by CARA. And many institutes, at least 50% are not doing it. Unfortunately, not doing it. So OEA is the screening test, BERA is a definitive test, but that is available only after 3 months. So OEA can be done at birth. So hearing, unless hearing is there, speech will not be there. So ears are there, looking nice, but whether they are hearing, that's very important. Number 2, vision. This is unfortunately yet not made compulsory by CARA. I would urge upon CARA to make it compulsory, because eyes are there, they are beautiful, but whether inside is okay, that needs to be checked, important. Right now we are monitoring all children with prematurity who have received particularly oxygen therapy. That is a must, but otherwise they are not getting vision examined. We are getting it done. Have the pediatric ophthalmologist or any ophthalmologist have a look at the inside of the baby's eyes. Activity and reflexes, then coordinated movements and progress and development is to be charted, it's to be followed up very carefully. This check immunizations, I tell the parents, don't be bothered about that. So whatever immunizations are not given, they always can be topped up. There is no issue. Detailed information to be enclosed regarding the vaccines, etc. Just skip this slide. So assessment is best done by detailed notes in antenatal care if they are available, birth history, admission. Number 2 is direct communication with the in-charge social worker and in-charge physician, that is pediatrician. Don't believe in the hearsay. मेरे neighbor का ऐसा हुआ, मेरे फूफा जी का बच्चे का ऐसा है. They cannot be compared. So believe in science and not in superstitions. Check the growth and development with due margin of the 2 months delay, nutrition, immunizations, and not, see the last sentence of every slide is important, and not just by battery of fancy testing. It is the, see, if I take an X-ray of my hand, if I take an MRI of my hand, and if I take the CT scan of my hand, and that of a dead body, it's going to be the same. Whether my hand is moving, my fingers are moving and catching, can be seen only by seeing the child. So it's not the costliest test which are going to give the information. It is by observing in, in live state. That's very important. And can you assess the brain function of a newborn baby? Yes. Answer is yes. Brain function of a newborn and its normalcy can be very well tested by what is called as neonatal reflexes, which are 96 in number, which can be examined in just 5 minutes time. These neonatal reflexes are there present at birth and ultimately disappear between 4 to 6 months. If they persist, something is abnormal. If they are not there, something is abnormal. If they are not bilaterally symmetrical, there is something abnormal. I will just show you some pictures that will be a little more entertaining. So they appear at birth, they disappear at a particular age. If they reappear, see, this is about old age. These reflexes come back in the old age, particularly if there is a brain tumor. So it's very important. Neonatal reflexes. They appear at birth, disappear between 4 to 6 months. Symmetry needs to be checked. Muscle tone can be easily checked. All these point towards neurological integrity. That means brain function and spinal cord function. So I think I have covered all this. For children a little bigger than that, you can check the speech also, which I will come to in 5 to 10 minutes. We have to see the potential of the normalcy, and acculturation is important that after going in your family. So what are the neonatal reflexes? This is just the names. So this is how the pictures look. The moment I touch the child's mouth, it will open and try to grasp something. That is called as a rooting reflex or sucking reflex. I touch the palm and the palm toes become like this. That is called as plantar grasp. If it is in the palms, it is called, that will also come, the palmar grasp. The child's neck is turned to one side, that side's hand goes out, its extension, whereas the other side becomes closer to the body. These are things, these are called reflexes, which indicates intact neurological system. Rooting reflex, see, I am touching the side of the cheek, I am not putting the finger in the mouth, I am touching the side. Child will turn its angle of the mouth to that side. These are fundamental for survival, because the child has to find out where is the nipple, where is the feeding source. That's why it is important. A baby of this age very well can step up. I keep the foot down here, under the table. It will pull up the foot and keep it on the table. That is that stepping reflex. Sucking reflex. See, it's sucking. It may be breast or bottle. Then this is the Moro response. If I just keep the head tilted 30 degrees and just leave it, child will show a startled reaction where the hands and feet, hands are thrown off and feet become closer. And this is the palmar grasp. I put anything in the palm across, it will grasp it. Try to pull it. I can pull the baby whole in one hand easily. Of course, you don't do it. It requires practice. And this is if I keep the child in this position, and it will just try to lift the body herself and always will never suffocate. Don't be afraid. Child will not suffocate. It will always turn the head to the other side, some side. So the nostrils are kept clean. Palmar grasp. These are more technical. I won't take them. I hold the baby in the ventral suspension. It's, upside down, and just touch it, tickle it here. The whole body will turn to that side. See, curve. So all these indicate, and this is blinking, Dola Marte. These are again the same thing, stepping reflex and grasp reflex and crawl reflex. Now coming to the important point, what is the incidence of missing an important diagnosis? Unknown background, I am talking about those 25% with 2 months observation. बाकी का तो मालूम है, we know the history, we know the clinical examination, we know the appropriate laboratory investigation. 3 pillars of diagnosis of a disease. Here I would just remark one thing, the diagnosis of a disease is comparatively easier than diagnosis of health. We are diagnosing health here, and that's why we have to be very cautious about this, because we have to what we have to tell whether this child is healthy or not. It's a diagnosis of health. Same thing, history, examination, and appropriate investigations. So what is the incidence of missing? We have missed 6 cases so far Out of this 12,100, 6 cases could not be diagnosed, and the incidence is definitely less than 1%. And whereas accepted incidence of missing a medical diagnosis after thorough history examination, etc., is 15 to 20% accepted to the medical community. Now, what are these cases? These could not be diagnosed at that age because they don't appear at that age. One of them is degenerative disease of the brain at, it should be 7.5 years. What was this? This was a Tay-Sachs disease, which presents after certain years. This child was adopted from Sofosh, went to Kenya, and there she threw a convulsion in the school at the age of 7.5 years. This child is still alive. They took her to UK, and after all the investigations, they come to the diagnosis of Tay-Sachs disease, and they handed child back to the organization. That is very sad, but that child is now 35 years old. So that cannot be diagnosed at that age. Secondly, a 1.5-year-old child, ASD, which does not show any murmur, and if there are no cardiac symptoms, heart symptoms, and it is not to be operated, this doesn't require surgery either, so that was missed. Second is focal glomerulosclerosis at the age of 7 years. So this is a kidney disease, it is a genetic disorder, and it doesn't come to manifestation before the age of 4 years. So sheer ill luck was adopted in Sweden, and she received adoptive father's Swedish origin genetics. And that kidney matched with this girl's HLA, and so she has received a very successful transplant way back in the 1995s when it was not available here. Thalassemia minor, it cannot be diagnosed below the age of 9 months. It cannot be. Thalassemia major can be easily diagnosed, not thalassemia minor. And 50% of the population here, I can tell you that they are thalassemia minors, unless you do a electrophoresis. So in India, thalassemia minor is very common. It is not going to affect the child adversely. So I won't call it missing. It cannot be diagnosed at that age. Coxa vara, that is a disease which comes to manifest after the child starts standing and walking. And this child had gone in adoption at the age of 2 months. It's correctable, but then it could not be diagnosed at birth. And hearing impairment, this was missed totally at the age of 4 years. I take the blame. Those days, OEA and BERA were not available. Now it is not pardonable. So this was in 1985. So now these tests are available. Therefore, I'm insisting that get this test done before you go for adoption. In a nutshell, see what is the incidence? Less than 0.1%. In nutshell, clinical and serial assessment is quite satisfactory rather than basing the evaluation on some fancy testing done once in lifetime. Please note, this is another question which often comes from the audience, that whether my child has got autism. हाथ जोड़ के बोलता हूँ, you cannot diagnose this below 3 years. You cannot. There are initial symptoms start getting noticed at the age of 2.5 years. So how can you diagnose? So that is the part you cannot do this testing. There is no testing. And therefore, even if it's a biological child to yourself, or whether it is a child from adoption, you can't diagnose these things. So what you will do when you go for adoption is that have all the records with you. Photocopy of every paper from that institute. They might say, ye to minor hai. Take a Xerox copy of that. If they don't allow, take the photographs in your camera now, the mobile camera, and preserve them in your bank locker. Then immunization record, you take them and whatever is missing, you can top up. Growth chart, very important. Development charts, very important. And answer to your questions, note down whatever answers are given by your doctor or your social worker, note them down so that you will ask new questions and not the same questions again and again. So please remember, there are variations in biology. Biology, of course medicine, that means medicine also, is a science of variation. Our 5 fingers are not same. They are of different size. They have different functions. So biological events are all in essence a science of variation and in contrast to mathematics. Hence, a wide range of normalcy is there. Please allow some margin of 2 months. I am emphasizing and repeating again and again. Dentition is delayed because teeth are not essential for life. What 3 things are kept behind by nature? because initially it's a struggle for survival. We saw all those negative points. So things which are not very much required for life: teeth, hair, and nails. Their growth may be slow, but it doesn't happen so, really speaking, but teeth are getting delayed. Essential organs to survive: skin, liver, heart, lungs, brain, kidneys. So their growth is essential. So if a child is malnourished, what happens? They keep the head size is big, abdomen size is big because liver is there. Hands and feet can become small. Same way. Second is, supporting weight on the legs may be typically delayed. Believe only in science, not in superstition, and have faith and patience like Sai Baba, Shraddha or Saburi. There are no brain tonics. There is nothing to increase IQ, but a very important tonic for brain is sleep. Now, why I am emphasizing on this? It's your modern gadgetry which has come in the way between sleep and, child sleep and proper rest, the growth of the brain. So there are no brain tonics. Whatever is advertised most is always false. Please remember this. Do you see the advertisement of water? But you will see advertisements of Coca-Cola. You will not see the advertisements of chapati. You will see advertisements of pizza. So these things are bad. That's why they are advertised. Chapati, bakri, no advertisement. No brain tonics, they are advertised maximally. But then what is the brain tonic? Good sleep. How much? Newborn 23 hours. 1 year, 16 hours. It goes on becoming less and less. But nowhere less than 10 hours for babies up to the age of 2 years. So keep away from TV, keep away from mobiles, keep away from iPads and all these things, and also the video games, not to skip the breakfast, fruits, etc., and open air exercises. Give quality time to the children, at least 1 hour per day. Carry your baby along with you as far as possible. Breastfeeding, of course, that is out of question for our babies. Touch and massage. Respond to the baby's need in timely manner, and read and sing to the children, and ensure iron intake, and monitor the hemoglobin up to 2 years. Stimulating environment, etc., etc. I think everybody. Now, what are the danger signals you must know by heart and act by your brain? These are the danger signals you should revise. The prospective parents should revise it every day in the morning. Number 1, baby's refusal to accept the feed. Number 1 dangerous symptom. You will feel that this is minor. Fever, kuch nahi hai. Up to 6 months, if the child refuses to take the feed, right now it might be 12 o'clock. If the child takes feed at 12 o'clock but refuses at 3 o'clock, it's a danger signal. If a child is less than 6 months, baby has to demand feeds. If it is not, either it can be pneumonia, it can be meningitis, it can be septicemia, even in the absence of fever. So these are the 3 major differential diagnoses. And therefore, they're killing diseases. Take the child to the child specialist immediately. Don't go for homeopathy, Ayurvedic, and I would say half-baked doctors. You have to go to full-fledged pediatrician. Seizures, convulsions, easily understandable. Even the doctors would panic if there is a convulsion. Third thing is bleeding from any side, easy to understand. Sudden blue discoloration, what happened in COVID, people used to become suddenly blue. That means oxygen is less. Always a major symptom. Diarrhea and vomiting is as urgent as heart attack in babies. So diarrhea and vomiting is to be seriously attended to. Jaundice is very different from adult jaundice. There are 1450 reasons of neonatal and pediatric jaundice. They are very different from common jaundice, what you see. Mal dal diye, then give this some herbal medicine and take some sugarcane juice. That jaundice is very different. This jaundice is very different. Breathlessness, easy to understand. If I become breathless, always a medical emergency. Sudden limb, child was playing well, suddenly the child started, stopped moving the right hand. Previously it was easy to diagnose polio. Now it is something other than polio, but it does happen even today. It can be even a fracture, pseudoparalysis. Foreign bodies. A child becomes very explorative after 9 months when it starts crawling and would put everything into the nose, throat, ears, vagina, anus, urethra, all sorts of openings in the body. They would put the foreign body, not purposefully of course, just inquisitiveness, exploring the things. So don't keep anything on the ground. Keep away from electrical points also, which are very easy to approach. Any symptom persisting despite good treatment for more than 2 days, 3 days, it so happens that the doctor writes recheck after 7 days in a case of fever. And the child is becoming bad despite treatment. It's my humble request to the parents, don't wait. It is a general comment that come after 7 days. If the child is not improving, you are with the child for 23 hours. You have to rush to the doctor again. So again, re-evaluation is required. And this is my horoscope. See, this horoscope is not dependent on the birth history. Where did it occur? Longitude, latitude of this place, neither on the birth date nor on the birth time. What is important for us from growth and development point of view, normalcy of the child, is number one, antenatal history. If the history is available, that means birth history of the child. Ante means before, natal means delivery. Whatever happened before delivery. Second is birth events. Whether this child was born normally by head or by cesarean or by forceps or by vertex. So so many other things are there. And whether the baby cried immediately at birth. I always make a little comment over here that if the child doesn't cry at birth, it makes the parents cry throughout life. It's that important. Third thing is feeding history. Of course, these may be missing in our cases. Feeding and nutrition, that is very much in our hands. Stimulation, that means physical stimulation as well as psychological and emotional stimulation. Development of the child needs to be watched. Education is very much possible in your families. That is perfectly your prerogative. Seventh is infections and illnesses. Immunizations I am giving secondary importance, because what is primarily important in prevention of infection is not immunizations. It is your care, nutrition. It is your cleanliness, not only your home, your surroundings also. Why people recovered from COVID even before the vaccine came? Not that everybody died. It is because of your own resistance. So number of diseases, hundreds of thousands. Number of vaccines, only 40. So only 40 there are vaccines. Vaccines are important, but not above your own health. Eighth is acculturation, what values you imprint into the child's mind. Exercises and sports, unfortunately, with the screen time being so high, exercises are occurring to both the thumbs, because everything is remote control. It's not on the ground. 10th is love and care. Of course, all of you will be giving. Rest, minimum 14 hours. Minimum 14 hours up to 1 year, then 12 hours, 8 to 10 hours. You and me, 9 hours. Social interaction. Man is a social animal. So you mix in your your other siblings or anybody outsiders also, they have to mix with children. So please remember, these are not special children, they are children in special situation. They are not special apart from anything, they are in a special different situation, as the Bible says. So whether genes are important or environment is important, for us environment is most important. Because I think we are born, I was born in 1949, some of you are born in 1990s, some of you might have been born in 1985. Do you have your genes in your hands? We can't control them. Whatever the genes have come from my parents are there with me. But do they affect the child? Answer is yes. Genes and environment both are important. Both have won the Nobel Prize. The ones which said genes are the exclusive ones which decide the child's and the adult's characters got a Nobel Prize. The scientists who said that it is only environment which is important, genes are of no importance whatsoever, also got a Nobel Prize. So the truth is in between. It is the expression of genes, I'll come to that, expression of genes. Genes, now it has been found after 2010 Human Genome Project that everybody of us all over the world, all across the universe, wherever the human beings are there, genes are the same. Then why some are tall and some are short? Why some are black and why some are very fair skinned and some are brown? And why the Mongol races have those mongoloids land? It is the expression of the same genes. So how the expression occurs? It depends on the environment. For example, sickle cell anemia is a major disease. Sickle cell anemia is very prevalent in certain parts of India and also in Africa. Why? Because that type of disease, hemoglobin, correctly and fully protects against malaria. And malaria doesn't kill these people. Otherwise, it's a killing disease. So the nature adopted these things. So genes are there. We took them or not. Pygmies are short. Why they are short? They are living in jungles. But their fighting capacity against the malnutrition is terrific, like that. So anyway, genes are also important. Environment is important. A combined effect is important. There is no existence of brain tonic. Good sleep is always there. And genes are units of heredity. They are the units of heredity. How many cells are there in the body? 50 trillion. 50 trillion cells are there in the body. Each cell has 46 chromosomes. A little technical one. I will show the picture, then you will understand. And each chromosome has more than 20,000 genes. Is the calculation there? 50 trillion cells are there. Each cell has 46 chromosomes. Each chromosome has 20,000 genes. And if you make the length of 46 chromosomes, if they are not packed together, it's 2 meters. It's 2 meters. Each cell, which is so microscopic, cannot be seen with the naked eye, each has 2 meter length DNA structure in it. They recombine the parental characteristics. One chromosome comes from the father, one from the mother, and the new chromosome is formed. They have the hidden instructions and governing the growth and development. And they interact in turn with the environment. Now, what is the environment of the genes? Is the cell structure, cell chemicals. What are these chemicals coming from? Nutrition. What are they coming from? External heat, external cold, everything. So these things affect the child's growth. They interact with the environment and bring in lifestyle, diet and pollution. That is called as epigenetics. That is called as the interaction between the genes and the environment forming the proper characteristics of a person is called epigenetics. Genes are not inert, they are interactive, and they have the effects of from conception to mother's womb to the outside world. Nothing is different in bringing up and that's why nothing is different in bringing up a biological and adopted child. If you want to go in details, my friend Dr. Sanjay Gupte has written this book, which was recently launched in the same hall about 2 months back. Somewhere else, but was formally inaugurated here. But that's a very complicated book. If you want, you can take this book and go ahead. And this is the structure of these 40 trillion cells having 40 trillion nuclei. Such 46 chromosomes are there. And this is the structure of the genes. And these are the inside nucleic acids. Please don't waste your energy on understanding all that. Remember that for us, genes are there, gifted by the adoptive agency in the form of a child, and you make different environmental factors. संस्कार उसके ऊपर करने का है. Whether we do genetic testing for all, can you demand for it? Big nonsense. Don't do it. I'm just clearly using these words, though they look unparliamentary, because you should see through it that it is not logical at all. You should not be doing the genetic testing unless it is indicated, unless really it is indicated. Some rules, same rules as those for testing a biological child. Only if immediate treatment is available, interest and privacy of the child is of the biological parents. Child is not a commodity, and adoption agencies are not guarantors of the child's life. So if tomorrow somebody gets convulsions at the age of 10 years, don't hold us responsible. It can occur to anybody. So the child is referred to you, and within 48 hours, as per CARA guidelines, you have to say yes or no. So what you look for, first and foremost, comply within the time limits. Number two, as soon as you get a referral, get in touch with the pediatricians. So when you enroll with the agency, check the nearby pediatrician also. Now, what should be the quality of a pediatrician? He should be MD or DNB. Check the degree. Number two, check the reputation. Number three, he should be nearby your house. Number four, he should be in the practice for at least 5 years. So he should be sustaining the pressure of practice and credibility for at least 5 years. And otherwise, preferably get the printouts. So Kara will be sending you the MER, medical examination report. So you can send it across to anybody. Number two, get a report, preferably when you go to a doctor, get a printed copy. If you or your doctor feels that information is inadequate, you can ask for more info. For example, the information is uploaded some 6 months back. The latest weight or head size may not be there. Get them done. You just call that agency and get this is very important, because whatever is reported at the time of admission and what is the weight now, what was the head size, what is the head size now, that difference is important. And special needs category, we'll talk about that in a subsequent slide, and not to worry about the vaccines, etc., because they can be always topped up. This is a very important chart. Luckily, we are instrumental in making Kara available and requesting them to make it compulsory for all the institutes, and they are now incorporated. It may not be in this format, but now they have to give information. Weight on admission and current, head size on admission and current, head length on admission and current. This gives you adequate information about the growth of the child and the growth potential of the child. So check the birth details if they are available. Check the OAE, which is missing in many institutes. That test is a very important test, has to be done. Check if the eye surgeon has checked the baby's vision. History of convulsions, hospitalization, etc. are important. If the child was admitted, many times they are requiring admission. How long the child was admitted? If more than 5 days, be skeptical. Something must have been really wrong. And if the child has suffered from some condition, whether it is curable, whether the condition is treatable or not. And what you will request on reaching that institute is that get a copy of all the papers, contact the institute's pediatrician and social worker. Check the feeding habits. Don't start new habits. I may be telling you the best of the habits, but don't start that way. Continue the same thing what that agency in Assam or Dibrugarh or Uttar Pradesh may be saying. Continue the same, at least for 10 days next after coming to your family. Gradually change. Otherwise, child can choke. Don't do that. So initial few days, don't take out the child at all. 1 week afterwards, then visit your chosen pediatrician. Special needs child to be managed more skillfully. We'll come to that. Now, what about the special needs child? There are 2 categories of children in Kara guidelines or Kara website. One is the normal category. Second is the special needs category. So, why I'm saying this? You get a special needs category faster. People are waiting for 3 years, 4 years, 5 years. So, that is number one. Not that all special needs categories should be really labeled as special needs categories. They can be very treatable. They can be very much incorporated into the family. And therefore, don't say just blindly no to special needs children. Now, what are the special needs children? Some, say six fingers, taken as thalassemia minor, sickle cell trait, can be accepted. Child with 600 grams of weight. Today it can be special needs. Tomorrow it will be normal child. So just check with your pediatrician. That list is coming to you more often. And check on what count the child is labeled as special needs. Oftentimes, or say HIV positive, ELISA, 2 times HIV, DNA PCR done negative, it's a negative child. Why are you keeping it as special needs? It's a very normal healthy child. Oftentimes there is hardly anything to designate the baby as special needs, but sometimes when you have opted for a normal child, you might be getting a special needs child. Hence, you have to always take the expert help. I have come across a child with developmental delay. This is from Nagpur and Wardha, 2 cases. Epilepsy, moderate mental retardation, sickling test positive. This was recent, 8 days back, where we, after asking, they did the sickling test, which was positive, and therefore the child becomes so special needs, but they had categorized as normal. So that particular help for you is very much required. So you can opt for a special needs child category with a faster process. For this, you may explore the 7-day placement and that she will tell you more. Immediate placement options. You will be able to view the list once your HSR is uploaded by that your enrolling agency. No, special needs categories are many times quite okay, and what you need is the expert opinion and experienced medical advice and proper guidance. So don't just hesitate to check the list of special needs as well. This is the vaccines which we give. This is the development chart. This is the growth chart which has to be asked for. Many institutes don't keep it up. And now what about the children who are, I'm coming to the end of my talk. Thank you for a very patient listening. The physical assessment of a child beyond 2 years, because there are children and categories of parents who are taking the children more than 2 years old. You are there, okay. So all these tests and neurological assessment becomes much easier if the child is speaking. If the child is speaking appropriate for 2 years of age, you are 90% through. That means IQ is okay, hearing is okay, speech development is okay. So physical assessment is rather easy and more predictable. Check head circumference and plot them on the growth charts, and check the development by assigning hand grip, hath pakadta hai ki nahi baga, climbing up and down the staircase, very important. General appearance of the child, teeth, check the speech is most important human faculty, speech. Ask about the social behavior, then the food habits, toilet trained or not. DQ, development quotient, might help in this situation. I was totally against IQ DQ below the age of 2 years. Here I am saying DQ might be of some help. And vision and hearing assessment by the specialist is very important. Even if the institute has done it, ask them to do it again, because it is not one-time examination. There can be changes afterwards. Now, immunizations beyond 2 years of age, I would just mention here that this schedule is a little different than what we start from birth. So we have to adjust accordingly. IIP has published all these guidelines. But blindly I can say that if the child is given these doses are missing and history is not there, the records are not there, blindly give MMR vaccine and EZ6 or Hexazim or Infanrix Hexa. These are 6 vaccines together. So easier to top up. And all these vaccines names. It is not possible to diagnose autism. So and psychiatric diseases, no, we can't diagnose them. Schizophrenia, severe mental depression, mania, they come usually after adolescent age is there, 18 years, 20 years. Can you see some signs? बाळाचे पाय पाळण्यात दिसतात, याच्यात नाही दिसत. Autism cannot be diagnosed below 2.5 to 3 years. Psychiatric disorders cannot be diagnosed below the age of 15, 18, 20 at the most. So let us all go, let's be very realistic and optimistic. Parent psychology does matter. So maybe it is a good idea to check the parent psychology. So coming to the end, this is a simile to germinating seeds. See, what we get, the baby is at this stage. This is a germinating seed which we have thrown on the ground and given little water and daylight. And it first throws the radical. Then radical sucks water and minerals, gives some power to this part, and it throws an offshoot. That turns green afterwards, and it captures the sunlight energy, prepares the food, and that is how the seed starts growing. And this is very vulnerable, delicate. What it requires? Soil, nutrition. What it requires? Water and minerals. What it requires? Sunlight. And this is optimal conditions for the growth and germination of the seed. So optimal conditions of germination for a baby to grow are given by these institutes up to the age of 8 weeks. So from admission time to 8 weeks is the time so that the baby becomes stable, is able to survive comparatively easily. And this is the stage of stability where you assess the normal child, A premature baby, this might take 3 months. Low birth weight baby, 3 to 4 months. If it is 600 grams, 1 year. So this is the only difference. So once the child is stable, we will be giving a sapling in your hand, which is 100% sure to survive. But the growth of this becoming into a big tree totally depends on your care and your love. So this is the story of Steve Jobs, very appropriate for this talk. Steve Jobs, as you know very well, founder of the world famous and probably always in the first 3 or 4 leading companies of the world, that is Apple. He was an orphan. His mother, the situation of orphans in the Western countries is terrible, terrible. It's not like us, not at all, much better here. At the age of 13, 14, he was adolescent, in the 8th standard. The neighbors of this family Jobs, not Job, their name was different. The father of this child is Lebanese, mother American, continuously quarreling, beating each other, alcoholism, and therefore school dropouts and school failure. And the neighbors ultimately complained, their tolerance vanished. And the system over there is that they will call police. The neighbors complained to the police that there is a quarrel occurring every now and then in this family and the child is getting affected. Within 7 to 8 minutes, the van came and took this child into their custody. Juvenile remand homes and then foster care in the Jobs family. They were simple people, caring people. To look after, by the way, to look after a baby who is 2 months old is very easy. 2 years old, okay. 5 years old onwards becomes difficult. You imagine this was 13, 14 years old. So child was getting brought up by they call it foster family, and they put the child gave loving care, put the child in the school. After 6 months, he was available for adoption. Physically sound. So the Jobs family, who had enrolled for adoption, there was a match between them, and they came to see the child. So what was the Jobs? They were carpenters. What was their ambition? To make the child PhD from Cornell University. Cornell is number 1, 2 in USA. They wanted the child to be PhD from Cornell University. So the foster parents showed the progress report saying that no, academically is poor. Every subject, 7 subjects, everywhere read, failed. But the Jobs family believed in that child's abilities. I don't know why, but then they had thrown a small wristwatch for repair, and he repaired in 2 minutes, which others could not. So some such stories are there. And they said, no, we would like to give another 6 months leverage. After 6 months, the performance was worse than before. To cut the story short, this man never cleared his 12th standard. Never. But the intelligence is not always measured by degrees. That is my point. In India, it does. It is important. But the Jobs family fulfilled their ambition by how? He delivered 4 consecutive lectures about life and business to the PhD students of Cornell University 2 years before his death due to pancreatic cancer. So in short, believe in your child. The situation of these children is something like a strayed, sideways ship, which I have photographed at zoo when we had gone for marathon. So here nothing is wrong totally. You just repair the engine, pull it back into the ocean, and it is still sailing. It's a temporary difficulty, temporary special needs, and you all will have a nice child. Thank you very much for patient listening. No hindrance. So that missing half leg is not an hindrance, and it can be practically very well overcome, realistically, scientifically, by taking care of those 2 months and further care by you. Thank you very much. Thank you, BSSK. I appreciate all this because I've been continued for 44 years by these August organizations, both Sofosh and BSSK, and I was looking after these children as a student in MD Pediatric, because that time the ward started as a separate unit. And what is standing with me is all the blessings of all these babies. Thank you very much.
Thank you very much, sir. On behalf of Bharatiya Samaj Seva Kendra, I extend our heartfelt gratitude to our esteemed guest and speaker, Dr. Navrange sir, for sharing his valuable expertise on the medical aspect of children in institutional care. Your insight have deeply enriched today's session. Thank you very much, sir. We are also extending a warm thanks to online viewers who have joined us virtually. Your presence and interest added great value to this session. Thank you very much. Now I request our dignitaries, Dr. Sanjay Patil, to come forward and share your views. Yes, Dr. Sanjay Patil is a Executive Trustee of IMA, Indian Medical Association, Pune.
गुड आफ्टरनून. मी थोडकं मराठीमध्येच बोलेल. आमचे नवरंगे सर आणि त्यांनी जे काही त्यांचं कार्य जे आत्तापर्यंत आपल्यासमोर उभं केलं, आणि मी तर म्हणेल की आज आपण या ठिकाणी जमलेलो जे आहोत हे सगळे, वी आर फॉर्च्युनेट की सर आम्हाला हा सगळा तुमचा प्रवास बघायला मिळाला. आणि भारतीय समाजसेवा केंद्राचं जे काम आहे इतक्या वर्षापासून आम्ही बघतो आहे, आणि मी स्वतः त्या ठिकाणी आलेलो होतो 1-2 वर्षापूर्वी, आणि खूप जवळून काम बघायला आपलं मिळालं मला. आणि खूप तळमळीने आणि खूप उत्साहाने तुम्ही काम करत असता, आणि असंच काम तुमचं पुढं चालू राहू द्यात. आणि कार्यक्रमाला खूप उशीर झाला आहे. मी पुन्हा एकदा आपल्याला शुभेच्छा देऊन थांबतो. धन्यवाद.
थँक्यू व्हेरी मच सर, तुमचं टाईम दिल्याबद्दल आणि उपस्थित राहिल्याबद्दल आजच्या कार्यक्रमासाठी. मी आता आपल्या कार्यक्रमाचे मान्यवर योगेश जवादे सरांना विनंती करते, त्यांनी त्यांचं मत मांडावं. योगेश जवादे सर इज अ असिस्टंट कमिशनर WCD डिपार्टमेंट, पुणे.
नमस्कार. मराठवाड्यामध्ये एक पद्धत आहे, नमस्कार म्हटलं की समोरूनच जोरात नमस्कार येतो. मी मराठवाड्याचा आहे. थोडंसं काय, तुम्ही पुण्यातली लोकं, म्हणजे हा डिव्हिजनचे तुम्ही पहिले स्वातंत्र्य झाले, आम्ही जवळपास 1 वर्ष 1 महिन्यानंतर स्वातंत्र्य झालं. थोडंसं आमच्यावर म्हणजे प्रॉब्लेम हा आहे की आमच्या रूढी परंपरा वेगळ्याच तिकडच्या, आणि मग जोडायला आम्हाला देशासोबत जोडायलाही वर्ष लागलं तर असो. सरांचं, मी नवरंगे सरांचं मी मधातून ऐकलं सर्व. मला असं वाटलं की मी जर हे लेक्चर माझ्या लग्नापूर्वी ऐकलं असतं तर माझे 2 मुलांमध्ये फार डिफरन्स राहिला नसता. ते फार चांगले राहिले असते. म्हणजे न्यूट्रिशनल व्हॅल्यू काय असतात किंवा ग्रोथ मॉनिटरिंग, ग्रोथ कशी करायची मुलांची, हे जर सरांचं लेक्चर जर पहिले भेटलं असतं तर फार लवकर चांगलं झालं असतं. पण असो, मी ह्याच फील्डमध्ये होतो, WCDमध्ये थोडाफार इम्पॅक्ट होताच याचा. माझी मोठी मुलीसोबत आम्ही हे काहीच केलं नाही, तर ती आजही तशीच कुडकुडीत प्रॉब्लेमॅटिक आहे. वारंवार काही पण, जर थंडी वाढली की तिला लगेच ताप येणार. पण लहानीसोबत हे सर्व एक्सपेरिमेंट केलं. ते म्हणजे ती इतकी हुशार आहे की ती तिच्या क्लासमध्ये सर्व गोष्टीमध्ये पुढे आहे, स्विमिंगमध्ये पुढे आहे, म्हणजे एकदम बढिया आहे. मग 2 चाइल्ड पाहताना फरक कळाला की पॅरेंटिंग कसं करायला पाहिजे होतं. एका ठिकाणी चुकलं तर ते आजही सुधरत नाही आहे, आणि एका ठिकाणी थोडेसे कष्ट त्याच वेळेस घेतले, त्याला पाहायचीच गरज पडत नाही. हे 2 डिफरन्स झाले. सरांनी जे सांगितलं ते मला थोडंसं माझ्याकडे पण आहे त्याच्याबाबत, की आम्ही काय म्हणतो बाळाचे 1000 दिवस म्हणतो, 1000 डेज. म्हणजे जेव्हा आईच्या पोटात बाळ असतं त्याचे 270 दिवस. बाळ हे आईच्या माता ही गरोदर असल्यानंतर 270 दिवस म्हणजे बाळ बाहेर येईपर्यंत हे 270 दिवस. आणि पुढचे 2 वर्ष म्हणजे आपले 365, 365, 730 आणि हे 230 असे 1000 दिवस. ज्या पॅरेंट्सला हे जमतं 1000 दिवस, त्याला पुढचं बाळाचं काय पाहायची गरज नाही. ज्याला हे 1000 दिवस जमले नाही, आता आम्ही भोगतो, एकामुळे भोगतो आणि एकाला हे केलं आहे म्हणून जरा व्यवस्थित झालं. म्हणून ह्या ज्या गोष्टी घडत आहेत त्या तुम्हाला ज्या सांगितल्या सरांनी खूप मस्त सांगितलं. हे खरंच आहे ना, जे मुलं किंवा जे कपल्स बाबा होणार आहेत, आई होणार आहेत, त्यांनी जर हे ऐकलं तर मला असं वाटतं की बाकी काही करायची गरज नाही. हे जर केलं तर फारच छान. सरांनी न्यूट्रिशनचा बेस पण दिला. आम्ही पण कधी कधी सांगतो लोकांना, की मातेला सांगतो की बाळाला जर तुला डोक्याची जर म्हणजे ब्रेनची डेव्हलपमेंट जर करायची असेल तर आपण काय खाल्लं पाहिजे, अक्रोड खाल्लं पाहिजे, कारण त्याच्यात ब्रेनचा आकार आहे. आम्ही असं त्यांना छोट्या छोट्या गोष्टीतून आम्ही समजून सांगतो. ग्रामीण भागातल्या महिलांना अक्रोड पाहायलाही भेटत नाही, पण जी त्यांच्याकडे असतात आम्ही मग पालक खे बाई, मेथी खा बाई, किंवा ॲपल जे भेटतं, आजकाल ॲपल मिळतं. कारण गावागावात आपली संस्कृती बदलली महाराष्ट्राची. कोकोकोला सर्रास मिळतं पा, कोकोकोला आपल्या गावात प्रत्येक ठिकाणी मिळतं. पण जर आपण म्हटलं मला सफरचंद पाहिजेत तर ती भेटणं मुश्किल होतं आपल्याकडं. पिशवीचं दूध मिळतं परंतु आपल्याला चांगल्या गोष्टी मिळू शकत नाही गावामध्ये. म्हणून ही थोडीशी बदललेली व्यवस्था असो म्हणा, हरकत नाही. परंतु आज BSSK सोबत परत जोडण्याचा एक संधी मिळते. तुम्हाला सांगायला हरकत नाही की हा आपला एक ॲडॉप्शन मंथ आहे. ॲडॉप्शनचा हा पूर्ण महिना पूर्ण भारतभर आपण सेलिब्रेट करतो. आपल्याकडे ॲडॉप्शनसाठी 3 कॅटेगरीज असतात, ऑर्फन, अबेंडन्ड आणि सरेंडर. ह्या 3 टाईपच्या कॅटेगरी असतात की जे आपल्या लगेच दत्तकला पात्र होतात मुलं. सरांनी बऱ्याच त्यांच्या गोष्टी सांगितल्यात काराच्या आणि त्यांच्या टेस्टबाबत सरांनी डिटेल्स बोललात, काहीच अडचण नाही त्याची. पण ही मुलं जेव्हा दत्तकला जातात आपल्याकडून, ही कुठल्या ना कुठल्या समाजाच्या वेगवेगळ्या कृत्यातून आलेली मुलं आहेत. ही आपल्यासारखी नाही आहेत की ज्यांना फार केअर अँड नर्सिंग मिळालेली आहे किंवा फॅमिलीचं अफेक्शन मिळालेलं आहे, असं काहीच नाही. ह्या मुलांसोबत सर्व डिफिकल्टीज असतात. आणि BSSK सारखा एखादा घटक, सोपस सारखा एखादा घटक हा जेव्हा त्यांच्यासाठी एक मायेची ऊब बनतो किंवा एक मदरचं काम करते, एक मातेचं काम करते, तेव्हा काहीतरी त्या मुलांमध्ये डेव्हलपमेंट होतं. आणि ती मुलं भविष्याचं कुठं ना कुठं एका फॅमिलीसोबत जोडल्या जातात. प्रत्येकाला माहीत असलं पाहिजे, म्हणजे आपल्याला काय फॅमिलीचं महत्त्व नाही आहे. म्हणजे माझं पूर्ण संगोपन माझं फॅमिलीसोबत झालं तर मला त्याचं महत्त्व नाही आहे. पण ज्याला फॅमिलीचं महत्त्व कोणत्या मुलांना, तर ह्या मुलांना सर्व फॅमिलीचं महत्त्व राहतं. हे एक ॲडॉप्शनची पहिली विंग मी जी सांगितली तुम्हाला, तर दुसरी विंग अजून एक ॲडॉप्शनची आहे, ती फॉस्टर केअर ॲडॉप्शन आहे. शासनाचा फार चांगला प्रोजेक्ट आहे. आपण महाराष्ट्र सध्या फक्त 17 अंकावर आहेत. 17 म्हणजे खतरा झालेला आता. म्हणजे 17च मुलं आपली ती फॉस्टर केअरिंगला गेलेली आहेत बाहेर. त्याला प्रतिपालकत्व म्हणतात मराठीमध्ये. यामध्ये कसं असतं की एक 6 ते 18 वयोगटातला बालक, 6 वर्षापासून 18 वयोगटातला बालकाला आपण आपल्या फॅमिलीमध्ये, म्हणजे आपण एक फॉर्म भरायचं काराच्याच पोर्टलवरती आणि फॉस्टरिंगसाठी आपण त्याला मागायचं. फॉस्टरिंग लगेच ॲडॉप्शनमध्ये कन्वर्ट होत नाही. फॉस्टरिंग वर्षभर चालतं. म्हणजे जेव्हा त्या मुलाला आपण ते फॉस्टरिंग पॅरेंट्सकडे दिलं, वर्षभरानंतर ते परत ॲप्लिकेशन करू शकतात आणि त्यावेळेस ते फॉस्टरिंग ॲडॉप्शनला पात्र होऊ शकतात. आणि यासाठी 6 ते 18चाच वयोगटाचा क्रायटेरिया आपल्याकडे, म्हणजे 6 वर्षापासून 18 वयोगटातल्याच मुलांना माहिती आहे. थोडंसं एक पास्ट हिस्ट्रीमध्ये नेतो ह्या ह्याच्याच बाबतीत, की फॉस्टरिंग आपल्या सर्वांना माहिती आहे बा. सर्वांना एक उदाहरण चांगलं माहिती आहे, श्रीकृष्णाचं उदाहरण माहिती आहे बा. जबरदस्त फॉस्टरिंग चाइल्ड आहे ते आपले. म्हणजेच जन्म कोणी दिला? देवकीने. आणि त्याचं पालनपोषण वयाच्या 13व्या वर्षापर्यंत कोणी केलं? यशोदे. हे असंच आहे फॉस्टरिंग थोडक्यात. म्हणजे जरी जन्म दिलेली माता आपल्याला माहीत नसली तरी पण त्यांचा आपण पॅरेंट्स म्हणून संगोपन करण्यासाठी आपण पुढे आलं पाहिजे. त्याला म्हणतात आपण फॉस्टरिंग ॲडॉप्शन्समध्ये, फॉस्टरिंग पॅरेंटिंगमध्ये. हे येण्यासाठी आपल्याला सर्वात महत्त्वाचं काम करावं लागेल की आपण आपल्या ह्या पूर्ण समाजामध्ये ह्या गोष्टीबाबत पुढे राहायला पाहिजे किंवा ह्याचा प्रचार केला पाहिजे. राजस्थान पुढे आहे यामध्ये. राजस्थानमध्ये जवळपास 50-55 मुलं आहेत. आम्ही जाऊन आलो, तिथे पाहून देखील आलो की त्यांचं काय कसं इन्व्हायरमेंट आहे, कसं वागतात. तर त्यांना तिथल्या पॅरेंट्स लोकांना त्यांनी ते अवगत केलेलं आहे की हे मूल तुमच्यासोबत फक्त 18पर्यंत राहिला, 18 नंतर ह्याची मर्जी तुमच्यासोबत राहणं न राहणं. म्हणजे बरेच आम्ही त्यांना प्रश्न केले. पण आपल्या इथे काय होतं की काम करताना ह्या अडचणी पहिले जास्त मोठ्या होऊन बसतात. अडचणीनं मात करायची आपण तयारी ठेवत नसल्यामुळं आपलं कधीही काम पुढं सक्सेस होऊ नाही लागलं. फॉस्टरिंगमध्ये आपण महाराष्ट्र सर्वात मागे आहे आणि ॲडॉप्शनमध्ये आपण सर्वात पुढे आहे. आपल्याला 2 नंबरला MP आहे तर आपल्याला दिसतही नाही MP खाली आहे म्हणून आपल्या. म्हणजे आपण एवढं मोठं टॉप केलेलं आहे ॲडॉप्शनमध्ये. ते कोणामुळे केलं आहे? संस्था, सर्व ज्या शिशुगृहाचं काम करणाऱ्या सर्व संस्था, आमची सारा म्हणजे आम्ही जे काम करतो महाराष्ट्र शासनाच्यामध्ये, आणि ॲडॉप्टिव्ह पॅरेंट्स जे आहेत त्यांच्यामुळं आज आपण महाराष्ट्र हा मागच्या 5 वर्षापासून, ह्या वर्षी पण टॉपरला राहणार, गॅरंटी देतो तुम्हाला आज मी या ठिकाणी. आम्ही गॅरंटीशी टॉपवर राहणार. तर या महाराष्ट्राला ह्यामध्ये आपण ॲडॉप्शनमध्ये टॉपर ठेवतो की प्रत्येक मुलाला फॅमिली मिळावी यासाठी आपण प्रयत्न करतो. परंतु ह्या फॉस्टरिंगमध्ये आपण नाही आहे टॉपमध्ये. आपण यामध्ये समवेअर आहे, कुठंतरी आहोत, काहीतरी आकड्यांमध्ये आहोत. हे 2018ला मी पहिले सुरू केलं होतं अकोल्यामध्ये. मी जेव्हा अकोल्याला होतो तेव्हा, ज्यावेळेस महाराष्ट्रात लवलेशही नव्हता या गोष्टीचा, तेव्हापासून मी यामध्ये आहे. अजूनही या कामाला तेवढी गती येत नाही. म्हणजे 18पासून काम करतो. पहिले मी जिल्ह्याला काम करायचो, आता राज्यासाठी काम करतो आहे. थोडासा वेगवेगळ्या घटकांवर आपण काम करताना बदल झाला आहे, प्लेसमध्ये बदल झाला आहे. परंतु सिच्युएशन जशीला तशीच आहे, तो तशीला तशीच उभी आहे. म्हणून आपण आहे ना, आपल्याकडे जवळपास नाही म्हटलं तरी महाराष्ट्रामध्ये 1,500 बालकं आहे आपल्या बालगृहामध्ये, 1,500 बालकं की ज्यांना आपण फॉस्टरिंगसाठी घेऊ शकतो. म्हणून मी समाजातल्या प्रत्येकाला आवाहन करतो की ह्या मुलांना फॅमिली काय हे लक्षात आलं पाहिजे. कधी कधी काय होतं की आमचं एक छोटीशी एक केस झाली ॲडॉप्शनमध्ये, आय थिंक सो मला वाटतं नगरमधली, अहमदनगर, अहिल्यानगर म्हणतो आपण सध्या. त्यामध्ये एका पॅरेंट्सला आपण मूल दत्तक दिलं, दत्तक ॲडॉप्शनमध्ये गेलं आणि 1-2 महिन्यानंतरच त्या मुलांना त्या पॅरेंट्सनी आलं आणि गेटवरच सोडून चालले गेले. मला अधीक्षकाचा फोन जेव्हा आला तर सर असं झालं म्हणे की आपल्या मुलाला डायरेक्टली गेटवर सोडलं, त्यांनी आजसुद्धा सोडलं नाही आणि डायरेक्ट सोडून पॅरेंट्स चालले गेले. मी म्हटलं सलग जा आणि लगेच त्यांच्या विरुद्ध FIR दाखल करून टाक म्हटलं, त्या पॅरेंट्सच्या विरुद्ध FIR दाखल कर. कारण असं होतं, कारण त्याच्या मागे जेव्हा आम्ही त्या पॅरेंट्सच्या फोनवर बोललो तर त्या लक्षात असं आलं की त्या पॅरेंट्सला जेव्हा त्यांनी ॲडॉप्ट केलं त्यानंतर त्यांचं कल्चर, त्यांचं ते घरातली व्यवस्था ती पोरं नीटशी हँडल करत नाही म्हणे. जो मुलगा ॲडॉप्शनला गेला आपला, तो नीटचं ते करत नाही आहे, ते प्रॉपरली घरामधलं मॅनेजमेंट तो करत नाही आहे. अरे ज्याचं मॅनेजमेंट आयुष्याचंच बिघडलेलं होतं थोडक्यात, तुमच्या घरात आल्यानंतर तो 2 महिन्यात कसा शिकेल. म्हणून जे पॅरेंट्स आहेत त्यांनी उतावीळपणा पण नाही केला पाहिजे की बुवा आपलं कल्चर लगेच त्यांनी ॲडॉप्ट केलं पाहिजे. आता जसं हिंदू कल्चरमध्ये तो मुलगा गेला तर लगेच त्यांनी प्रे त्याला लगेच शुभम करोती आलीच पाहिजे असं नाही होऊ शकत. त्याला प्रत्येक गणपती स्तोत्र आलंच पाहिजे असं नाही होऊ शकत. ख्रिश्चन कम्युनिटीमध्ये गेला जर त्याला लगेच त्याला बायबलमधले काही त्याला कोट्स आले पाहिजे असं नाही होऊ शकत. हे आपलं कल्चर आहे, आपल्याला त्या मुलाला सोबत ठेवून शिकवावं लागेल. अशी मी बरीच फॅमिली पाहतो त्याच धर्माची, परंतु त्या मुलाला काहीच येत नाही. म्हणून ह्या मुलांकडून आपण अपेक्षा ठेवतो की लगेच आपण ॲडॉप्शन केलं म्हणजे हा लगेच आपल्या फॅमिलीचं समरूप होईल आणि आपलं कल्चर ॲडॉप्ट करून हा जसं तसं चालेल. आता जसं आमच्याकडं थोडक्यात एखादं व्हेजिटेरियन फॅमिलीकडं मूल गेलं, पूर्ण व्हेजिटेरियन फॅमिली असेल, पण आमच्याकडं गव्हर्नमेंटमध्ये आम्ही त्यांना संडेला नॉनव्हेज देत असतो, ते खातात मुलं. तर त्या ठिकाणी पण क्लायशेस होतात, त्या ठिकाणी पण त्या मुलाला परत सोडलं जातं की नाही बाबा हे नॉनव्हेज खाणारा मुलं. हे सर्व माहिती असतं, हे सर्व सांगितलं जातं, तरी पण हे नंतर त्या मुलाच्या गोष्टीमध्ये कुठे ना कुठं हा डिफेक्ट येतो आणि त्यांना असं वाटतं पॅरेंट्सला की हा मुलं आपल्या घराशी एकरूप होत नाही. म्हणून ॲडॉप्शनमध्ये ह्या गोष्टी आहे ना, पॅरेंट्सच पहिले काउन्सिलिंग होणं फार गरजेचं आहे मला असं वाटतं. पॅरेंट्सचं काउन्सिलिंग झाल्यानंतरच मुलाला पण पॅरलल काउन्सिलिंग आमच्या लोकांनी केलं पाहिजे. म्हणजे कसं की तुला जायचं आहे बाबा, तुला फॅमिलीमध्ये जायचं आहे, हे व्यवस्थित त्याला ग्राफ करून द्यायला पाहिजे. अन्यथा हा जर ग्राफ व्यवस्थित झाला नाही तर प्रॉब्लेम येतो. शासनामध्ये मी काम करतो ना, पण बेसिकली सर्वजण आम्ही जे काम करतो ते करत असताना आम्हाला थ्रेट्स बरेच असतात. असं काही की नाही आम्हाला सर्व गोष्टी सोप्या आहे. एक जपानमध्ये एक म्हण आहे पहा, म्हणजे आम्ही जेव्हा काम करतो आणि शासनामध्ये कसं काम होतं किंवा आपल्या देशात कसं काम होतं एक सांगू शकतो त्या कोट्सने, म्हणजे तुम्हाला लक्षात येईल की जॅपनीज एक म्हण आहे की इफ वन कॅन डू यू कॅन डू, इफ नन कॅन डू यू मस्ट डू. म्हणजे ही जॅपनीज म्हणे बरं. तुम्हाला सर्व जे मुलं आता नवीन फ्रेशर्स आहेत कॉलेजमधले आहेत त्यांनी लक्षात ठेवा. पण इंडियन म्हण वेगळी होते. तिथं इफ वन कॅन डू होतं ना, इकडं उलटं चालतं, इफ नन कॅन डू व्हाय आय कॅन डू. कोणीच करू शकत नाही तर मी कशाला करू. म्हणजे आमच्या शासनात पण असंच असतं. मी फॉस्टरिंगमध्ये एवढं काम करतो, बाकी कोणीच करत नाही. म्हणजे त्याला वाटतं हे करतं तर करू द्या. इफ वन कॅन डू, इफ नन कॅन डू व्हाय आय कॅन डू, इफ वन कॅन डू लेट हिम डू. म्हणजे ते माझ्यासोबत असं चाललं आहे की बा मी एकटा करतोय तर त्याला त्याचं काम करू द्यावं. म्हणजे शासनामध्ये असं असतं की कुठलाही सपोर्ट सिस्टीम आपल्या अधिकाऱ्यांची म्हणत नाही, कर्मचाऱ्यांची म्हणत नाही, कोणाचाही विचार एका गोष्टीसाठी समग्र येऊ शकत नाही. कारण पाहणं व्हिजन देवाने प्रत्येकाला डोकं वेगळं दिलेलं आहे. आता 2 वर्षातच आपले सेल्स वाढतात, पण शासनामध्ये आल्यानंतर 2 वर्षानंतरही ब्रेनचे सेल्स वाढतात. आपल्याकडे डॉक्टर सरांना माहिती, तुम्ही त्या प्रोफेशनमध्ये असाल तर बाळाची फक्त जर ब्रेनची डेव्हलपमेंट आहे ती एकदम फास्ट 2 वर्षात होते. 2 वर्षानंतर ही डेव्हलपमेंट अतिशय संत गतीनं कासो तरी फास्ट चालतो, त्याच्यापेक्षाही संत गतीनं डेव्हलपमेंट होते. म्हणून 2 वर्ष का सांभाळायचे, 1000 डेज मी का म्हणतो सांभाळायचे, ते लय महत्त्वाचे. पण आमच्या लोकांचे हे म्हणजे प्रशासनात येण्यापूर्वीचे डेज वेगळे आणि प्रशासनात आल्यानंतरचे डेज वेगळे. म्हणून तिथं डेव्हलपमेंटची काही स्कोप नाही आपल्याला. तर आपण सर्व, मला 2 मिनटं दिले त्यांनी, अजून 2 मिनटं बोला म्हणून. तर आपण ज्यामध्ये काम करणार, आपण सर्वजण मिळून काम करणार, एक समाजाच्या ह्या मुलांना कुठंतरी आपलं मातृत्व मिळालं पाहिजे, फॅमिली मिळायला पाहिजे, हे फार गरजेचं आहे. आणि तुम्हाला एक सांगतो की आमची जी मुलं, आता मी सांगितलं 1500च्या जवळपासची जी मुलं आहेत, ती रोज तो अधीक्षक पाहतात. रोज अधीक्षक तो त्याच्या बायकोसोबत भांडलेला असतो, तो समोर त्यांच्यासोबत येतो, तेच केअरटेकर असतात, तेच जेवण करणारा तोच माणूस त्याच पद्धतीचं जेवण करतो रटाळ. आई तरी वेगवेगळं जेवण करून खोगलते आपल्याला. म्हणून आज आपलं डेव्हलपमेंट आहे ना. तर त्या मुलांना कुठंतरी फॅमिली मिळायला पाहिजे, हे माझं पण स्वप्न आहे. हे पूर्ण आपल्या महाराष्ट्राचं स्वप्न असलं पाहिजे. आणि बालगृहात एकही मूल राहायला नाही पाहिजे, याप्रमाणे आपल्याला जायचं आहे. म्हणून ह्या सर्व ॲडॉप्शनमध्ये BSSKला शुभेच्छा देतो. त्यांनी हा एक छान प्रोग्राम ठेवला. आणि आम्हाला BSSK एक सपोर्ट असा आहे की कोणत्याही गोष्टीसाठी आता ते एक वेगळ्या टप्प्यावर काम करतात की जे मुलं त्यांच्याकडून गेली त्या मुलांचं सध्या फीडबॅक घेत आहेत की बुवा ते मुलं सध्या कोणत्या स्टेजला आहे, काय करतात, असं चांगलं काम ते करतात. तर त्यांना आपल्या खूप खूप शुभेच्छा देऊया. त्यांनी आम्हाला ह्या डायसला भेटायला बोलायला दिलं, त्याबद्दलही त्यांना खूप खूप शुभेच्छा द्याव्यात. आणि त्यांनी नवरंगे साहेबासारख्या नवरंगे, ज्यांच्यामध्ये 9 गुण आहेत, नवरत्न व्यक्ती असतात, त्यासारख्या व्यक्तीला ऐकायला दिलं तर आजचा तर फलित झाला. आजचा दिवस आपल्याला कबूल झाला आणि हे लाईफ टाईम मिळेल. तर सरांना जेव्हा जेव्हा मी पॅरेंट्सला भेटू तर सरांना इन्व्हाइट करू आणि सरांकडून अजून चांगल्यात चांगलं आपण मार्गदर्शन घेऊ आणि आपली पिढी मजबूत करू आणि उत्तम करूया. तर थँक्यू सर, थँक्यू ऑल ऑफ यू, थँक्स अ लॉट.
थँक्यू व्हेरी मच सर. तुमचे मार्गदर्शन अतिशयच आम्हाला कायमस्वरूपी उपयोगी पडतं आणि नक्कीच पुढे पण पडेल. यानंतर मी मान्यवरांना विनंती करते, थोडे 5 मिनटं तुमचे आम्हाला हवे आहेत, कारण का या कार्यक्रमासोबतच अजून एक कार्यक्रम आपण ठेवलेला आहे, तो म्हणजे आपल्या विद्यार्थ्यांचं प्राईज डिस्ट्रीब्युशन ठेवलेलं आहे. आपण या 2025 नोव्हेंबर हा जो नॅशनल अडॉप्शन अवेअरनेस मंथ म्हणून साजरा करतो, त्या संदर्भातच त्याच ओकेजनवरती आपण कर्वे इन्स्टिट्यूट ऑफ सोशल सायन्स या कॉलेजमध्ये स्लोगन कॉम्पिटिशन घेतलेलं होतं. त्या संदर्भात हे प्राईज डिस्ट्रीब्युशनचा प्रोग्राम ठेवलेला आहे, एक्सटेंड टू दिस प्रोग्राम. सो जे स्टुडंट उपस्थित आलेले आहेत त्यापैकी म्हणजे त्यांना सगळ्यांनाच खूप सारी उत्सुकता असणार आहे आम्हाला समजतं आहे, पण तुमचा खूप वेळ घेणार नाही आहे आम्ही. सो आय रिक्वेस्ट डॉक्टर जवादे सर, सॉरी डॉक्टर नवरंगे सर, जवादे सर, शर्मिला मॅडम, अलका मॅडम, मान्यवरांनी स्टेजवरती यायचं आहे. स्लोगन कॉम्पिटिशनबद्दल थोडक्यात सांगण्यासाठी मी राजेशी ताईंना विनंती करते.
सो नॅशनल अडॉप्शन अवेअरनेस मंथच्या निमित्ताने आम्ही जेव्हा ठरवलं की हा अवेअरनेस खरं म्हणजे MSW स्टुडंटपासून सुरू झाला पाहिजे, कारण पुढे भविष्यामध्ये फील्डमध्ये काम करणारी हीच लोक असणार आहेत. आणि गेल्या 2 वर्षापासून आपण सातत्याने हा प्रयत्न करतो आहे की त्यांचा बेस पक्का व्हावा ॲज अ सोशल वर्कर. आणि म्हणून मागच्या वर्षीसुद्धा आम्ही अडॉप्शनला धरून स्ट्रीट प्ले घेतला होता. त्या संदर्भातलं कॉम्पिटिशन आम्ही घेतलं होतं सातारा जिल्ह्याच्या कॉलेजमध्ये, आणि स्टुडंटचा खूप भरघोस आम्हाला प्रतिसाद तिथंही मिळाला होता. यावर्षी कर्वे कॉलेजमध्ये आम्ही स्लोगन कॉम्पिटिशन घेतलं, आणि आमचा पर्पज हाच आहे की समाजामध्ये कायदेशीर दत्तक, म्हणजे पालक जेव्हा दत्तकाचा विचार करतात तेव्हा त्यांनी कायदेशीररित्याच पुढे जावं. आणि आपण बघतो की आपल्या अवतीभोवती पण खूप सारी बालकं आहेत की ज्यांना केअर अँड प्रोटेक्शनची गरज आहे, पण ही मुलं प्रॉपरली, म्हणजे ज्या लायसन्स संस्था असतात किंवा जिथून त्यांची काळजी आणि संरक्षण कायदेशीररित्या होऊ शकतं तिथपर्यंत पोहोचत नाही आहेत. तर त्यांनी तिथपर्यंत पोहोचावं बालकल्याण समितीमार्फत. ही जी छोटीशी गोष्ट आहे पण खूप महत्त्वाची आहे, ही रुजवण्याचा प्रयत्न आम्ही ह्या स्लोगन कॉम्पिटिशनमधनं केलेला आहे. आणि आम्हाला खूप छान असा प्रतिसाद आम्हाला कर्वे कॉलेजमधनं मिळाला. आम्ही एक्सपेक्ट केलं होतं की हार्डली 15-20 स्टुडंट येतील पुढे की जे पार्टिसिपेट होतील, पण 44 स्टुडंटनी यामध्ये सहभाग नोंदवला. आणि आणि प्रत्येक स्टुडंटनी जे काही स्लोगन देण्याचा प्रयत्न केला खरंच खूप छान, आणि म्हणजे क्रिएटिव्हिटी तिथं निदर्शनास आली. आमच्या प्राईज काढताना आम्हाला खूप डिफिकल्ट गेलं ॲक्च्युअली. जी आमची टीम होती ज्यांनी हे प्राइजेस, मी नव्हते त्या कमिटीमध्ये, सो जी आमची टीम होती त्यांनाही खूप डिफिकल्ट गेलं. सो थँक्यू सो मच शर्मिला मॅडम आणि ठाकूर सर, ज्यांनी आम्हाला कर्वेबरोबर आमचं जे काही हँड होल्डिंग चालू आहे आत्ता स्टुडंटबरोबर काम करत असताना, सो त्यांचे मी खूप आभार मानते. आणि जास्त वेळ न घेता आपण प्राइजेस अनाऊन्स करूया. एनी गेसेस, कोणाला मिळालं असेल फर्स्ट प्राइज? ओके, सो लता प्लीज गो अहेड.
So, tick count start. So I will announce third winner, Monica Gadge. Please come forward. This is her poster which she has done it. जवादे सरांना मी विनंती करते त्यांनी प्राईजचं डिस्ट्रीब्युशन करावं.
याला जे आपण रूल केले होते ना, त्यामध्ये सगळ्यात महत्त्वाचा होता की स्टुडंटला आम्ही मोबाईल बाजूला ठेवायला लावले होते. लास्ट मिनिट टॉपिक अनाऊन्स केला गेला होता, आणि त्याचबरोबर फक्त स्लोगन नाही तर प्रेझेंटेशन पण इम्पॉर्टंट होतं. सो ह्या तिन्ही फॅक्टर कन्सिडर करून आपण त्यातनं प्राइजेस काढलेले आहेत.
नाउ सेकंड विनर कोण असेल? आर्या दफाले. I request Dr. Navrange sir to hand over the prize. Thank you very much, sir. Now I request Alka madam to hand over the prize. And which is the prize now? First prize. Any guess? तनिष्का मंदारे.
सगळ्यांनी मिळून द्या.
सगळ्यांनी मिळून द्या सर. Heartily congratulations to all the winners. जसं मगाशी ताईंनी सांगितलं की सगळ्यांनीच अतिशय छान पद्धतीने त्यांची कला दाखवलेली आहे, त्यांचं क्रिएटिव्हिटी दाखवलेलं आहे. सो आमच्या दृष्टिकोनातून सगळेच विनर्स आहेत. सो नाव बाकी जे अवेलेबल स्टुडंट्स आहेत त्यांनी पण त्यांचं प्राईज घ्यायचं आहे, कारण पार्टिसिपेशन प्राईज हे सगळ्यांनाच मिळणार आहे. सो आय विल कॉल.
त्यांचे पण आम्ही मागे दाखवतोय हा स्लोगन.
त्यांचे पण स्लोगन्स आम्ही मागे डिस्प्ले केलेले आहेत, प्लीज बघा. आय वुड लाईक टू कॉल प्रचिता. इट सीज देअर. श्रीमंत. अष्टविनायक. राजवंदना. 5 can come together. प्रीती.
फर्स्ट 3 प्राइजेस मुळे ना.
प्रीती. कोमल. ऋतुजा. श्रेया. अपेक्षा. प्रज्ञाली. सौरभ. अंकिता. अतिश. मल्लीनाथ. रेणुका. गौरव. ओम प्रकाश. शेफाली. चारुशिला. रवीना. अंजली. स्वाती. वृषाली. गजानन. गौरी. तन्मय. विकास. शीतल. प्लीज जे अवेलेबल आहेत त्यांनी स्टेजवरती यायचं आहे आपलं पार्टिसिपेशनचं सर्टिफिकेट रिसीव करण्यासाठी. शीतल. नेहा. अभिषेक. वैष्णवी. विक्रम. गायत्री. सन्वय. आरती. ज्ञानेश्वरी. शिवानी. अजय. ऋषिकेश. हिराम्मा. all MSW students sir.
सगळ्या स्टुडंट्सला वर बोलू, एक फोटो घेऊ ग्रुप आणि नंतर आपल्या सगळ्या सोशल बरोबर.
All students are requested to come forward. We wanted to take a group photograph. नंदिनी ताई तुम्ही पण पुढे यावं. आणि all the officials as well, we are requesting you to come forward. We can take a group photos with the students. Shatrudna sir, Vijay sir, Chaya madam. हो सर. IMA dignitaries are requested to be wait for a moment. देशमुख सर, तुम्हालाही वरती यायचं आहे. All the social workers are requested to come forward. Thank you very much, sir, and all the participants. I request Sharmila Madam, she is the Pradhyapak, she is the professor at Karve Institute of Social Science, to say her view.
Namaskar. It's a great pleasure to stand before this audience and say a few words, because I know it's a time up. But I just want to thank BSSK for coming to Karve Institute. I say this coming to institute because last year Rajeshri ma'am and Lata had personally come to Karve Institute की आपण टायअप करू आणि आपण MSWच्या स्टुडंट्सला काय काय ऑपॉर्च्युनिटीज देता येतील, म्हणून खरंच आभार तुमचे की शी हॅड कम अप. वी डिड हॅव फील्ड वर्क प्लेसमेंट्स लॉंग बॅक, पण कोविडच्या नंतर जे बंद झालं होतं ते आम्ही पुन्हा रिवाईव्ह केलं आणि याच्यानंतर गेल्या वर्षीपासून फील्ड वर्कही सुरू आहे विद्यार्थ्यांचं त्यांच्याकडे. आणि आजची ही जी झालेली कॉम्पिटिशन, ऑफकोर्स मी काय कॉर्डिनेटिंग म्हणून होतेच, पण राजेश्री मॅडमनी याच्या मागे मला वाटतं सातत्याने जे काही या दोघींनी सुरू केलं की ते स्लोगन देणं किंवा त्याचा फ्लायर येणं आणि विद्यार्थ्यांशीही जे नेटवर्क केलं, त्यामुळे मला वाटलं शक्य झालं. आणि नो डाऊट विद्यार्थ्यांचंही खूप कौतुक की ज्यांनी पार्टिसिपेट केलं आणि प्राइजेस मिळवले. आय थिंक दॅट्स ऑल्सो कॉंग्रॅच्युलेशन टू ऑल स्टुडंट्स अँड थँक्यू BSSK फॉर दिस अपॉर्च्युनिटी टू कर्वे इन्स्टिट्यूट अँड आय थिंक विल हॅव अ लॉंग असोसिएशन डेफिनेटली. हॅपी इयर वन्स अगेन टू सी लता, शी इज माय स्टुडंट. त्यामुळे विद्यार्थी असे दिसतात तेव्हा खूप छान वाटतं. सर त्याचप्रमाणे विजय इज ऑल्सो आवर स्टुडंट आणि मी अगदी लिफ्टमध्ये येताना दिसल्यानंतर अरे बापरे म्हटलं हो, पण आता गव्हर्नमेंट ऑफिशियल्स आहात तुम्ही, त्यामुळे बट या नवरंगे सर तुमचं ऐकलं आणि माझी प्रतिक्रिया खरंच तुमच्यासारखीच की मी आधी ऐकायला हवं होतं तुमचं लेक्चर. आणि डॉक्टर्स काय बघतात पण आम्हाला माहिती नव्हतं, लॉजिकल रिफ्लेक्सेस खरंच माहिती नव्हते. छान वाटलं, वाचणं वेगळं आणि ऐकणं वेगळंच आहे, त्यामुळे खूप छान वाटलं. अँड आय थिंक आय कॅन पास समथिंग टू माय स्टुडंट्स, सो आय एम रिअली हॅपी अबाउट इट. फॉस्टर केअरच्याबद्दल थोडंसं सर मला असं वाटलं की या आपल्याला अवेअरनेस खूप जास्त करण्याची गरज आहे. म्हणजे अशी अडॉप्शनची जरा माहिती आहे म्हणू, पण त्या प्रमाणात फॉस्टर केअरची नसते. तर थोडं आपण कर्वे इन्स्टिट्यूटबद्दल काही करता आलं तर आय विल रिअली बी हॅपी विथ यू. थँक्यू सो मच फॉर दिस अपॉर्च्युनिटी.
थँक्यू व्हेरी मच मॅडम. आणि सगळ्यात मोठा थँक्स आहे तो प्रॉस्पेक्टिव्ह अडॉप्टिव्ह पेरेंट्स जे पर्सनली या आजच्या कार्यक्रमासाठी उपस्थित राहिलेले आहेत. ऑनलाईनसाठी आपण बघितलेलं आहे की खूप मोठा मॉब अवेलेबल होता आणि आपण म्हणजे खूप साऱ्या पालकांनी त्याचं ॲडव्हान्टेज घेतलेलं आहे आजच्या सेशनचं. पण पर्सनली काही पालक वेळ काढून आल्याबद्दल त्यांचं खरंच मनपूर्वक थँक्यू. आणि सर्व विजेत्या विद्यार्थ्यांचं पण खूप खूप कॉंग्रॅच्युलेशन्स ऑन बिहाफ ऑफ BSSK. तुमचा व्ह्यू अतिशय ब्रॉड ठेवा आणि भविष्यामध्ये अजून काही गोष्टी करू शकणार आहात ह्याची खात्री तुम्ही नक्कीच मनाशी बाळगा. यू विल गेट समथिंग आउट ऑफ इट. कंटिन्यू टू दिस वी एक्सटेंड अवर ग्रॅटिट्यूड अँड heartfelt thanks to IMA who have given this opportunity with the collaboration without their collaboration and Department of WCD with their collaboration as well, this program could not be a success program. So we really thanks and appreciated their contribution. ऑन बिहाफ ऑफ भारतीय समाज सेवा केंद्र वी ऑलवेज म्हणजे आम्ही खूप सर तुमचे आभारी असणार आहोत. भविष्यामध्ये तुमच्याबरोबर काम करायला मला अजून आवडणार आहे. सो वी रिअली थँक्स for your valuable time, opportunity, and giving us this dais to present this program and make this successful. Thank you. Now we announce the program is closed. Thank you.